an absolutely crucial stakeholder, industry. Philip Cronin is the chair of the Australian Information Industry Association, an organisation that is also supporting enthusiastically the introduction of electronic health records, and whose members will play a crucial role in the seamless implementation of the whole process. But actually, Philip in his working life is General Manager of Intel for Australia and New Zealand, so he's got a unique insight into how information technology can enhance many aspects of our lives, but in particular, the provision of healthcare. So, Philip, we look forward to hearing what you've got to tell us about this. Thank you.
Thank you. Thank you, Peter. Let me firstly pay my own respects to the traditional owners of this land and that fabulous welcome this morning before I go any further. Also to the Minister for staying with us during what's been a very long session this morning. And I'd like to just tell you that I am between you and lunch. So I'll be brief, I hope. And I'm not known for it, by the way. But greetings, everybody, and thank you again on behalf of the AIIA, on behalf of the industry itself, for giving us some time to share with you in our vision for this journey. As Peter mentioned, I am the new chair of the Australian Information Industry Association. Some of you may or may not know us. We actually are the representatives of the large and small local and overseas ICT companies in Australia, working right across the many sectors where ICT, oddly enough, intersects just about every part of our world today. And it's very easy and very clear to state that our members will be, as you would imagine, very focused on the technology solutions, whether we're talking about returns to the national economy or the bottom line of any small business. We typically are all technologists. We typically are all true believers in technology. And it's often difficult sometimes to parse that and stay very focused on what it is technology actually is meant to achieve for you. Let me try and do some of that, because it is rather notoriously difficult to measure some of those benefits and those flow-on benefits, particularly where ICT undercuts and underpins an entire range of industries, as I mentioned. Healthcare in particular presents us with an environment where there are some far more important dimensions. And indeed, as we start talking about not just the ICT, but the outcomes for patients and the opportunities that ICT can deliver to make a difference to the lives of everyday patients in just about every way. Within the AIIA, we've had a very long-standing commitment to promoting the value of eHealth within Australia. For a number of years now, the AIIA has convened the special eHealth interest group in order to drive the right debate and the right connections between the ICT industry and the stakeholders across government and the healthcare sector and consumers. It's something we take as an industry, we take very seriously, because we know that the right outcomes take time and careful planning to develop. As an association, we support the idea of patient-controlled electronic records. The concept of patients being actively involved in healthcare and having control and involvement of the sharing of their information is a very strong one. And we believe that it is not only achievable, but that is an important step to be taken into the future. Now today, and probably to the rest of the day, you'll have been surrounded by facts and compelling arguments about healthcare during the rest of the day. I'm going to try and avoid some of them because already I have heard some of the key ones. There are some that are worth hanging your hat on and having some thought about. Somewhere in the range of up to 25% of a clinician's time, as we heard from somebody today, is spent collecting data and assimilating that information about their patients. And it is estimated that up to 18% of medical errors occur as a result of inadequate availability of patient information. Better management of information in the healthcare sector is estimated to drive a reduction in the 80,000 or so medication misadventures each year, a reduction in hospital administrations due to adverse events, a reduction in inappropriate hospital referrals, which are in the realm of some 35%. But more importantly, better management of disease to deliver better patient outcomes. I don't think this opportunity is one that we can ignore. And what's more, the healthcare system is increasingly moving towards from a doctor-centric, one-on-one type environment to a more patient-centric environment. Patients now, as Steve pointed out, have the power to research and move between healthcare professionals in a way that in the past was never really possible. And we may think this is not just something that elderly patients may or may not do. There are entire groups of adults coming through the system who will engage with their healthcare providers in very different ways, using research that they will take control of. Electronic records provide the right information to the right person and that are controlled by the patient make a great deal of sense. Better management of the system is something that the information industry can deliver with confidence in what we would term mission-critical situations and deployments. The system will work if we take the right steps to implement the solutions properly. The industry as a whole has many years' experience delivering technology solutions in mission-critical situations and deployments, but we know that there are clear requirements that extend to every stakeholder in order to deliver a successful outcome within the healthcare environment. This ICT industry of ours has a very positive role to play in that success, but it is a process that must be based on strong engagement at every level of the ICT industry, government and the health sector. And we need to base these solutions on some very clear principles. Australia cannot afford to roll out some off-shelf technologies or a solution that is uniquely customised to an Australian environment and developed in a bespoke manner, and at the same time hope to provide a solid foundation for the future. Australian eHealth solutions should be developed on ideas that are well tested both here and around the world. We believe that a viable solution must be developed on an open standard to allow for competition and innovation. It will be essential for Australia to adopt appropriate international best practice and standards if we are to keep costs down and deliver a truly effective solution. The AIIA supports the HL7 and the EHR as national and international standards, and we believe these are appropriate as we move forward. We also need to think practically. In order for this system to work, we need the confidence of the mums and dads and the sons and daughters that the system which will be implemented. The whole system will depend on public confidence in both the privacy and security of patient records, something we've heard a lot of today. Now, 20 years ago, some of these same concerns were applied to the finance sector. Privacy and security is something that the ICT industry takes very seriously. It is impossible now, NAB notwithstanding, to imagine a finance sector that is not underpinned by the information industry through online banking and e-commerce. And indeed, most businesses would find it difficult to turn off their ICT requirements at a given state. Therefore, we support a strong, secure privacy model, and the industry has many years of experience across almost every sector of business and the economy delivering these outcomes. From that experience, we know that good privacy and strong security is not limited just to software technology and design. It must be developed in tandem with the right policy and the correct legislation from the outset. Let me put it to you this way. Privacy plus security plus policy plus law equals confidence. There is simply no way around this big picture requirement to carefully coordinate all of the elements that lead to the right system. The Privacy Commissioner states her principles clearly. We need to make sure we get privacy and security built in from the beginning and not bolted on at the end. Now, it's a very good phrase, and it applies equally well to technology as a business model. You can't simply bolt a technology solution onto a business, nor indeed a health outcome, and hope for a good outcome. It is not something that can be added at the last minute to an existing plan in the hope that the plan will then become electronic. Technology must and needs to be an integral part and an early part of the development of new business models. The real benefits of technology come through collaboration and strong engagement at every stage of the planning, and I would underline that collaboration. The AIIA encourages every department, and indeed the industry itself, along with every government state government to engage closely with the ICT sector as they plan the outcomes being sought both in electronic health records and across eHealth in general. The stronger the engagement, the better the outcome. The ICT industry will also be a key driver of innovation in the delivery of solutions, and in turn that innovation will be essential to their ultimate success. In that respect, the government should look to the ICT industry for new ideas, not merely as consultants and reporters, but for innovation. Government must take a very proactive role in fostering innovation if it is to thrive. With these elements in place, the intelligent application of technology solutions to projects such as the patient-controlled electronic health record has the potential to deliver exponential returns to Australian citizens and the healthcare sector as a whole. Now is the time to act, and I encourage the department to think about the long-term benefits. Let me lay out some of them for you. By 2018, there will be some 10 million homes and around 16 million users connected to the national broadband network. 10 million homes and approximately 16 million users, patients of yours. The opportunity is huge, and it beckons. We have to have the vision to imagine the types of services and solutions which need to be available and which perhaps don't yet exist to large groups of Australians. Why can't we envisage a world in which we harness the power of technology to reduce hospital waiting lists, to deliver real-time healthcare directly to elderly patients in their homes, to dramatically reduce infant mortality rates in Indigenous populations, and create a platform for innovation which is the envy of the world? Australians enjoy a unique position in the world. We have a world-class health system, some of the best health outcomes across the globe, and a strong desire for a high quality and equitable care in a geographically challenging location. The advent of new technologies linked by high-speed broadband will enable us to leapfrog many of our neighbours and can give rise to a fertile local eHealth industry with export potential within the region and beyond. We also have the opportunity to attract the right skills and to be competitive in that same landscape. This will in turn increase Australia's productivity. The ICT industry can play a compelling role and a positive role in the development of these outcomes. I would emphasise the need for international standards on the basis of eHealth in Australia, and the industry's role will depend on close partnership and collaboration with the government and with the healthcare sector. So many years ago, Robert Kennedy paraphrased George Bernard Shaw when he said, "Some people see things as they are and say, why? I like to see things as they could be and say, why not?" So let me end on behalf of the AIIA and the industry by commending you to be both visionary and bold. Thank you.
Thank you, Philip. Well, that idealistic call to arms was a very appropriate conclusion to this session. It's nice to know that all of the stakeholders have got so many positive ideas to contribute to a successful outcome here, and I know it's going to be valuable. All right, well now, just before you break for lunch, a couple of things I should mention to you. After lunch, we're breaking up into a couple of workshops so that you have more of an opportunity to feed some ideas and suggestions of your own into the process. If you're not sure about which room and which workshop you're going to, just check the back of your lanyard. It will be there. That's for the workshops this afternoon and also for tomorrow. If you happen to have arrived late and you don't have that information on the lanyard, go to the reception desk here, our own registration desk, and all will be given to you. Also, I wanted to mention to you the breakfast tomorrow morning. Dr. Chris Pearce, one of the clinical leads at Netta, will be showing his PCEHR demonstrator. Now, some of you might have seen this at previous workshops. If you haven't, it really is well worth making the effort. But look, once again, for catering purposes alone, we need to have a registration of numbers. So if you can go to the breakfast, 7:30 tomorrow morning, to have a look at Chris Pearce's demonstration, please register at the facility at the registration desk. Now, just as we go to lunch, you might like to see some of the comments that have been made by people who've attended the pre-conference workshops. They're very interesting reactions. And we'll get together here after the second of the workshops this afternoon to hear about the experience in Denmark and how electronic health is working in that country. Okay, everybody, so enjoy lunch. You must be ready for a relax. And just take in some of these comments from people who've been to pre-conference workshops. Thank you, everybody.